Hello, I'm here today with Tracy Shepherd-Regan, Clinical Director of Indulgence Skin, Laser and Beauty Clinic Daventry. Hi Tracy, how are you today?
Hi, Leanne. I'm really well, thank you. And you?
Fabulous, thank you, and thanks for joining us. I really appreciate you giving up your time today. Now, Tracy, I've noticed that you've recently published something on Facebook and Instagram that you've become accredited, certified in the early signs and detection of melanoma and skin cancer. And I was just wondering if you wouldn't mind just chatting to me today and then telling me a little bit more about that, because I'm sure that I and your patients would love to know more about what that means for us. So what is this course, Tracy? I know that, if you don't mind me saying, I read this strapline to say, what was the actual strap? Let me read it. Training eyes to save lives. So over to you, Tracy. What was
Yeah.
it that you did?
Okay. Well, it was an online course, and I was prompted to do it because I had a patient of mine a little while ago who had a suspect lesion on his neck, and I said to him I didn't like the look of this lesion. I'll tell you a bit more about the ABCDE in a while, but I thought, well, it would be useful for me to, even though I knew that didn't look right, and he subsequently had it treated, it did turn out to be a melanoma because I told him it needed to be checked, and he did go and get it checked and had it removed and successfully. So obviously that all was well. But I thought it'd be really useful for me to expand my knowledge and get a bit more understanding of different types of skin cancers and how I can signpost people to get the appropriate help and diagnosis.
Did you come in for that, for you to have a little look at the mole? Was there a mole removal? Because I know you do that.
Yeah, no, he didn't actually. No, he was seeing me and had been for a number of years for treatment for anti-aging, for wrinkle treatments with injectables. And I'd known him for some time, and I just noticed this what looked like a mole just underneath his hairline at the back here, and it was just an odd shape. And I said, "Oh, I don't really like the look of that. I think I'd get that checked out if I were you, sooner rather than later." And it's just as well he did.
That's amazing. That's really amazing. So what is it that what were the highlights of the course for you?
So I already had some knowledge around skin cancers and the different things to look for. So it's reinforced some of that, and it's just helped me gain a better knowledge about identifying particular sort of precancerous lesions and what melanomas might look like, and what basal cell carcinomas and squamous cell carcinomas look like. And skin cancer's on the increase, and each year there's over 210,000 diagnoses of skin cancer. So it's gone up in the last decade by 45%. So that's quite alarming, really. And actually, most of the time they're preventable. There's a lot of really simple things that we could be doing to prevent getting skin cancer.
What sort of things would you advise me, your patients, to do?
Well, one thing is sort of knowing, kind of keeping an eye on your lesions and knowing, having some idea what to look for. So they gave me this booklet, which is really useful. And you can see, so there's like A, B, C, D, E of skin cancers, and or what you should be looking for when you're looking at lesions. So you're looking for, the A is for asymmetry. So if you've got something that, if you split it in half and one side looks different to the other, then that might be a cause for concern. You're looking at the border a bit. So if it's got a well-defined border, that's usually not suspect necessarily, but if it's got an ill-defined border, if it's got rough edges and it's not clearly defined, then again, that's another cause for potential concern. And you need to look at the colour as well. So if something's got, in this case, the chap I was just telling you about, his lesion was actually uniform in colour, but it was an odd shape. But if there's different colours in a lesion, that could be a cause for concern as well. And also, it might be changing in colour, so it might become darker or more red, or it could be growing or changing. So any lesions that you've got anywhere on your body that could be changed and should be checked out. And then you're looking at the diameter. So if you've got something that's greater than 6 millimeters in width, then that's basically the size of an eraser at the top of a pencil. There's something that's bigger than that, but not always. It could be smaller. Bigger than 6 millimeters may be a cause for concern as well. And the evolving is it changing? So you're looking for things like, is it changing? Is it growing? Is it changing colour? Does it itch? Does it bleed? All those kinds of things may be a cause for concern. So those are things to look out for. And in terms of, what I would advise people to do in terms of protecting themselves and trying to avoid increasing their risk of skin cancer, we're looking at, like the 5 S's. So if you look on the SKCIN website, it'll tell you the 5 S's. The other thing is that the sun gives off different rays, so most people don't realise that they're doing just as much potential damage to their skin in the winter, because the sun gives off UVA, UVB, UVC. UVB is the burning ray, that's the one that we feel in the summer, so it doesn't get so deep into the skin, but it does create tanning, it does contribute to tanning, and it does potentially burn the skin, so UVB for burning. And UVA is the aging ray, so that's the one that's around all year round. So the minute you open your curtains in the morning, you've got UVA on your skin because we get daylight indoors. So glass and cloud doesn't protect you because the daylight obviously comes from the sun. So we're still getting UVA all through the winter as well, even though we don't feel it. And that's the one that gets a lot deeper into your skin.
Just as I know that you sent me a picture one time to pop on your website of that driver whose face was really aged because his right hand or left hand side was right next to the window all the time, and the other side was much younger looking and unaffected. Yeah, very powerful.
Sorry, the UVC cancer causing ray, but that's blocked by the ozone layer. So this is another reason that the incidence of skin cancers are on the rise in the UK, whereas you'd think they might be on the rise in Australia, but they're not to the same degree, because obviously Australians, where there's more risk because of the ozone layer there, so they protect their skin much better. They've got much hotter sun, so they tend to protect much better. So I think we don't protect ourselves so well in the UK, which is why it's on the rise.
And you really, you always bang on to me about where the SPF, and I think, yeah, but it is so important, isn't it, now more than ever, as you say, with this rising cases. And you recommend I put it underneath my my foundation.
Yeah, it should be the last thing on your skin, kind of under your makeup. But we do various SPFs in the clinic anyway, and you can get a good quality SPF that's not full of chemicals, that works as a makeup as well. So if you don't want like an extra layer, you could just use some of the SPFs that we have that have a colour in as well, like that work like a foundation but give you the protection.
What about foundations that say they have SPFs in it? Is it okay just to put that on and not an underneath protection?
Yeah, if it's a high enough level, but you need to have at least a factor 30 on your skin. And the factors that we've got mostly are factor 40 plus, which give you much better protection.
That's really good advice. So thank you, Tracy. I love again that you studied all of this, and thanks for taking time out to share all this great stuff with us. So be careful. Look for the ABCDE rules and wear sunscreen. A big learning, and just keep yourself safe out there, basically. Thank you, Trace. I'd love spending time with you, and we'll catch up soon for some other hints and tips from Indulgence Skin, Laser and Beauty Clinic. Thank you.
Thanks, Leanne.
Take care.
Bye.